Welcome. My name is Jeff ECKER, and I'm the Chief of Obstetrics and Gynecology at Massachusetts General Hospital. Thanks for taking the time to watch this video. We would like to share some information about family-centered care at Mass General and how our team of nurses, obstetricians, midwives, and lactations consultants will support you and your family during your pregnancy, your stay on labor and delivery in our postpartum unit, as well as after you've gone home. We found that many of our patients have the same questions and concerns about feeding their babies and their stay in the hospital. Whether or not you breastfeed, you and your baby will receive evidence-based standard of care. We're here to share some important information about what to expect and how your choice of infant feeding can impact both your health and your baby's health. We are not here to pressure you or induce guilt about your choice of feeding. So let me emphasize again our commitment to support and care for you and your family and provide best evidence-based care regardless of your feeding choices. It's important to us to provide you with the tools to make an informed decision. We hope that this video will help to answer some of your questions and help you make informed choices about how you feed your baby. Many thanks for letting us help to take care of you and your family.
Hi, my name is Lauren Hanley, and I'm an obstetrician gynecologist here at the Massachusetts General Hospital. I'm also a lactation consultant, and I'm the medical director of lactation here in our department. The model of care we are going to introduce here today applies to all mother-baby couplets, regardless of how you choose to feed your baby. If you choose to formula feed for medical or personal reasons, our team will teach you the proper technique to feed your baby, as well as how to mix the powdered formula while you are in the hospital.
Hi, my name is Dr. NICOLE RANDAZZO-AHERN, and I'm the director of the newborn nursery here at Massachusetts General Hospital. Everyone needs good nutrition, but it's even more important for babies and children because they need good nutrition to grow and develop. Your breast milk is more than nutrition. It also protects your baby. Your breast milk keeps your baby from getting sick, and it lowers your baby's risk of asthma, allergies, and sudden infant death syndrome, also known as SIDS. Your breast milk protects your child for a long time, long after you stop breastfeeding. For example, it lowers your baby's risk of being overweight later in life, and it lowers his or her risk for adult diabetes and some types of cancer.
Hi, my name is Allison Bryant, and I'm a high-risk obstetrician at Mass General Hospital. Breastfeeding is good for you. It lowers your risk of breast cancer, ovarian cancer, and diabetes. It burns about 600 calories a day, making it easier to lose some of the weight that you gained during pregnancy. And breastfeeding also helps in other ways. It helps your baby's brain develop. It helps develop a close bond between you and your baby. It saves money in formula and healthcare costs and cuts down on the days that you miss from work. And breast milk is a natural resource, so it's great for our planet. By breastfeeding, you're doing something that's good for you and your health and your baby's health for life.
Hi, my name is Blake Slack, and I'm a midwife at Massachusetts General Hospital. Immediately after your baby's born, he or she will be placed on your bare chest and remain there undisturbed for at least the first hour. This is called skin-to-skin care. During this time, we will teach you how to provide skin-to-skin care safely for your baby. There are many reasons why we encourage skin-to-skin contact, both immediately after birth and actually in the days and weeks following. The first reason is that this is the best place for babies to make the transition to life outside the uterus. Holding your baby skin-to-skin helps to keep your baby warm and calm. If you think about it, your baby was used to hearing your heartbeat inside, so it's nice for them to be able to be on your chest still hearing your heartbeat, and it's a familiar and a comforting sound for them. Your baby's vital signs, that is her heart rate, breathing rate, temperature, and blood pressure, are most stable when the baby's held skin to skin. Even blood sugar levels are better. Some babies can be a bit chilly when they're first born, so we like to dry them off and place a hat on their head to help keep them warm. But keeping your baby on your chest is the single best way to help keep your baby stay warm. We'll put a warm blanket over the two of you to keep you both cozy.
Hello, my name is Michelle O'Hara, and I'm a nurse director here at Massachusetts General Hospital in the Labor and Delivery Unit. Our routine practice is to start skin-to-skin care right after your baby is born. In some situations, you or your baby may need some additional care before skin-to-skin can start. If you have a cesarean delivery, the pediatric specialist will examine your baby right after delivery. And then, if all is well with you and your baby will be placed on your bare chest for skin-to-skin contact within 5 to 10 minutes of birth. In order to allow your baby the greatest benefit of skin-to-skin contact, we will wait to weigh your baby until she or he has breastfed at least once, or earlier if there's a medical indication. Additional procedures such as the eye ointment and the vitamin K injection will also be completed after your baby has breastfed and is at least 1 hour old.
Hi, my name is Annie. I'm a nurse and lactation counselor at Mass General Hospital, and I work in the lactation clinic here. There are many more benefits to skin care. It allows for important early bonding. It also makes your baby more likely to latch well for breastfeeding. Babies who are skin to skin are more likely to breastfeed longer and without any formula supplements. Babies who are skin to skin will show their mothers when they're ready to feed. It also makes it easier for parents to recognize these early feeding cues when baby is held skin to skin. It is important to keep your baby safe during skin to skin contact. Your baby should be placed directly against your chest with her head turned to the side and looking slightly up toward your shoulder. You or your partner should be able to see your baby's nose and mouth. If you get sleepy while you're holding your baby, especially if you're taking strong pain medications like narcotics, you should put your baby in a safe, separate sleeping area like the crib or bassinet.
Hi, my name is Eric Clinton, and I'm the Medical Director of Labor and Delivery and Postpartum at Massachusetts General Hospital. Getting to know your baby and recognizing your baby's feeding cues is often easier when your baby is kept in your room with you throughout your hospital stay. Here at Massachusetts General Hospital, we practice family-centered care. You and your baby will have the same nurse who will teach you and your partner many things about caring for your baby and understanding your baby's needs while they are in the same room as you. All exams, vital signs, and tests will be done in your room. The early postpartum period is a unique time of joy, and it's exhausting. We know that many families have concerns about getting enough rest in those first few days of birth. Studies actually show that mothers who keep their babies in their room with them, as opposed to mothers who send their babies to the nursery, get about the same amount of sleep. But those babies who room in with their mothers sleep better and cry less.
Hi, my name is Janet Bell, and I'm a newborn nursing practice specialist here at Massachusetts General Hospital. We know that babies who room in with their mothers breastfeed better and longer than babies who spend time in the nursery. This is because you will be with your baby to notice the early signs that he or she is hungry and will be able to offer your breast before he or she becomes upset. Calm babies enable better feeding sessions and calmer parents. Remember, babies who room in cry less often, sleep more, feed better and longer, and are more likely to gain more weight and become less jaundiced. Mothers who room in with their babies are more likely to sleep better and longer as well. They are also more likely to have more success with breastfeeding and understand their baby's feeding cues better and more quickly. Sometimes there are medical complications or specific situations that require a mom and baby to be separated. We are here to make sure you and your baby are both safe and supported in the most appropriate setting.
Hi, my name is Jeannie Twigg Taylor, and I'm a lactation consultant at Massachusetts General Hospital. The signs your baby makes when he or she is getting hungry are called feeding cues. Your baby is telling you how often she needs to eat. Learning and responding to these cues is the best way to make sure your breastfed or formula-fed baby is getting the right amount. We recommend allowing your baby to nurse anytime your baby shows early signs of being hungry. This should be about 8 or more times in a 24-hour period. How often your baby shows you feeding cues will vary. It may be every hour for a few hours, then he or she may have a longer period of sleep. This is completely normal. Remember, don't watch the clock, watch your baby. Feeding your baby or on cue will lead to your milk supply being well matched to your baby's needs, and your baby will cry less and be happier.
What are some of the early feeding cues you might see for your baby? Well, sticking the tongue out and smacking the lips is a common one. In addition, you could see rooting or turning the head to the side, sucking on the hands, fluttering of the eyes, increased alertness and beginning to move around more. There could be some changes in facial expression of the baby, or squeaking noises or light fussing. A late feeding cue, or a sign that your baby is very hungry and a sign we'd like to avoid, for the most successful latching is crying. It is quite challenging to get a crying baby to latch onto the breast, so the best thing to do is to take a few minutes to try and calm or soothe your baby. This is a great time for your partner or another friend or family member to step in and give you a break. Your partner can hold the baby skin to skin and try to calm the baby. You can also soothe your baby by putting a clean finger in their mouth to suck on for a few minutes before trying to feed again. You can rock or sing to your baby as well. You can hand express a few drops of milk to place onto your baby's lips to help calm as well. And then, once your baby is calm, you could try to latch to the breast again to try for successful feeding.
Hi, my name is Amelia Henning, and I'm a nurse midwife at Massachusetts General Hospital. I'm also a lactation specialist. As you're putting your baby to breast, it is important to make sure you and your baby are well positioned and that your baby latches correctly. This will help you to make more milk and your baby to get enough milk. It also prevents you from getting sore nipples. If the baby is not properly latched onto your breast, your brain doesn't get the right messages to make the milk, and your baby cannot effectively get the milk from your breast. When a baby has a good latch, he or she has a good amount of the whole areola in her mouth, and her lips are wide open. Baby is relaxed and in a tummy-to-tummy position with mom. There are many other positions that can make breastfeeding more comfortable. You can try nursing in the laid back position, using a football or clutch hold, or lying on your side. Experiment to find out what works best for you and your baby.
Introducing formula when you and your baby are learning to breastfeed can decrease your milk supply and make breastfeeding more difficult. Introducing a bottle and even a pacifier can make your baby less likely to breastfeed well. Formula can also change the bacteria in your baby's gut, which is important for your baby's immune system. Sometimes your pediatrician may recommend formula for a medical reason. If this is the case, it is okay and very temporary. It is important to remember that our team is here to support whatever is healthiest for you and your baby, and this may involve the use of formula. We do not recommend the use of pacifiers while you and your baby are learning to breastfeed. Again, sucking on a pacifier can cause your baby to miss a feeding, and this can decrease your milk supply. However, once breastfeeding is well established, or if you decide not to breastfeed, the American Academy of Pediatrics recommends using a pacifier when your baby is sleeping.
When you go home with your new baby, you will likely have more questions about breastfeeding. Please reach out for help, especially if you are having pain with breastfeeding or your nipples are sore or cracked. Many resources are listed on our department website. For example, the Milk Mother Infant Lactation Club is held weekly at Revere Health Clinic. In addition, there is a lactation clinic on Yaqui 4 for mothers and babies who have more complex breastfeeding issues. Another great way to locate breastfeeding support is online at zipmilk.org.
We hope that this video has provided you with some useful information to help you meet your goal for feeding your baby. Many people ask how long they should breastfeed. The American Academy of Pediatrics, as well as the American College of Obstetricians and Gynecologists, the American College of Nurse Midwives, and the major medical societies recommend exclusively breastfeeding your baby, which means giving your baby only breast milk, for the first 6 months, then to add solid foods and keep on breastfeeding your baby until he or she reaches 1 year or longer if you desire.
Our MGH OB team of nurses, midwives, lactation consultants, nurse practitioners, and physicians is here to help you and your new family get off to the best start. If you have any questions about anything you have learned in this video, please ask your provider.